out there today. So we're going to point out 5 of the top Medicare scams, and hopefully with this information, it'll protect you or your loved ones. So let's go through the list. This is also a live Q&A as well. Every time I do a list of 5 or 6 or 7, I always throw a few more in there. A little bonus round. So I'll talk a little bit about some extra stuff in there about what's going on with these crazy Medicare calls. I've got some people that get 20 or 30 calls a day from Medicare people trying to switch their plans or trying to find usually they're trying to find your Medicare number. So we'll go into all of those here today. So let's go ahead and get set up. And what we're talking about is, so the top 5, the number 1 is a new Medicare number. And Medicare hasn't switched their Medicare numbers for many, many years. It was crazy. When I worked at Social Security, the Social Security Administration used to tell people all the time, don't carry your Social Security number around in your wallet or your purse or anything like that, because if something happens, you lose it, you got your license in there, and now they've got your Social Security number and your date of birth and all that address and everything, so don't do that. But at the same time, your Social Security number was on your Medicare number, on your Medicare card, and you needed to have your Medicare card with you at all times in case of an emergency. So it was always a stupid thing to say. So anyway, so they finally fixed that several years ago, and now Medicare cards, if you have a Medicare card with your Social Security number on, you need to get rid of that. You need to get the new one. It's a beneficiary number. It's a kind of a weird number that they've come up with, your personal ID number for Medicare. So it's no longer your Social Security number. But we get people out there that call up, says, "Oh yeah, you need a new Medicare number. So tell us the information, tell us what your Medicare number is now, and we'll send you out a new one. And maybe it's going to be one of these nice metal cards. We're switching to a metal card." No, there's no metal cards. We used to have people come in and they would have a metal Social Security card, and they said, "No, this is my card. I've had this card forever. This is what I was issued by the Social Security Administration." I said, "No, Social Security never issued cards like that." Some places went out there and they would print a metal card for you, and I guess your parents gave it to you, and you always thought it was from the Social Security Administration. No, Social Security has always been on those flimsy little Social Security numbers. Same thing on a Medicare card, same flimsy paper card. So there is no people making a new card, maybe in the future. Well, they are talking about Medicare saying they're going to be switching, or Social Security is going to be switching to a digital Social Security number, so you don't actually need the paper Social Security number anymore. But that's what Doge is talking about. But every time I talk about what Doge is, they've come out with this new policy, I have to come out with a new video the week or a month later where I have to say, okay, they said this, and now they did 180, and they're not going to do that anymore. And then I come out with another one, and then they come out a few weeks later and said, okay, we changed our mind. So they really don't know what they're doing. So digital Social Security card, don't know. All right. Another scam out there is free medical equipment, braces, Medicare equipment, the Medicare medical equipment. This was really bad a few years ago. Remember, there was that company that was selling those little rascal scooters and stuff and defrauded Medicare by lots of money. Medicare finally closed those things down. If you need a scooter, then because of that whole scandal, it's 10 times more difficult to actually get one of those mobility the scooters because of the scandal. All of the, few people make it harder for everybody else. Typical type thing. Anyway, but if someone contacts you, this is usually not a scam that's going to cost you money necessarily, but it's going to cost you taxpayer money. It's going to cost us all money. What they do is they say, hey, we can get you, whatever this, that, and the other, so for your bathtub or some mobility or whatever the case may be, we'll get you something that you would like, oh, that'd be nice to have that. But without a doctor's prescription, without a doctor's authorization for that, then what's going to happen is they'll ask for your Medicare number. It's always about getting your Medicare number, and then they bill Medicare for whatever, some type of brace or some type of thing for your bathtub or something like that. And it's usually 10 times more than what it should cost. They bill Medicare under your Medicare number, and then they send you some junk. And they're basically ripping off Medicare and you, obviously. All right, so we need to watch out for that. If you don't have a actual doctor's permission, a doctor's note, a doctor's prescription to get X, Y, and Z, then don't, believe people at shopping malls or people that cold call you and say they're going to give you X, Y, and Z. Okay, another thing out there that people are going door to door and they're at fairs and shopping malls in different places, and they say they will give you genetic testing and DNA testing, and it's all covered by Medicare. So they swab your mouth or whatever, and they get your Medicare number, and then they charge Medicare usually for something completely different. And then you get the bill. You should always review your bill, even though, with all of this, it's good to review this stuff. Even though Medicare pays for it and you're like, oh, okay, people just look at it and says, oh, what do I have to pay? And if it says zero, you do nothing, then people just throw it away. Let's stop that. If you got a few minutes, check it out. And if you see anything strange, or you see anything that's way, way too, well, all healthcare in America is way, way too expensive. But if you see anything really out of the ballpark, make sure you contact Medicare, the hotline, the office, the inspector general, the fraud line, and we need to start shutting these down. All right, another thing that they're trying to do out there is threats. They do this on both sides. They do this with Medicare. They also do this with Social Security. They contact you and said, hey, your Medicare is going to stop because of whatever payment or whatever the case may be. Same thing on Social Security number. They're going to shut your Social Security number down. I used to get calls when I was at the Social Security Administration on my private phone. I'd pick it up and they say, hey, Ed, you've got some warrant and we're going to shut down your Social Security number and yada, yada, yada. I'm like, okay, what's your name? What's your DO? And they find out I worked at Social Security and they immediately hung up. But it was a fun couple of minutes to harass them a little bit. But be careful on that one. Medicare will not cold call you and tell you stuff like that. It's all about the letters. You'll receive an official letter. And if it looks official, but a little bit suspicious, call Social Security, call Medicare and say, hey, it looks like you're going to shut down my Medicare because of non-payment. And this is actually going to be happening a lot, unfortunately. People are going to get their Medicare shut down. Or more of the fact is a lot of people are going to start getting billed for Medicare. Because of the big, beautiful bill, Congress decided that it's beautiful to cut a lot of people off of Medicaid, and the people that were receiving Medicaid, a lot of those were also receiving the Medicare Savings Program, where Medicaid was paying for your Part B premium, that $185. So a lot of people are going to lose that, and then they're going to have to start paying the $185 themselves. And they lose their Medicare Advantage dual eligible plan with the grocery cards and all that. Okay, so we're working on that to help y'all on that. So make sure you subscribe, like, and share with our new program that we're coming up to help y'all on that. And that's a good segue to the next one, these fake enrollment calls. It's coming up toward the end of the year. Wow, it's already August. So in October 1st, the new Medicare plans come out for 2026. And as every year during this time, you're going to get tons of calls, and you're going to see a whole bunch of football players and starship captains on the TV talking about this, that, and the other. They've really Medicare has really shut those down recently, because one of the things some of these places were doing is they were taking the best plan in the country, and that was only available in like one zip code or one area, and then they advertise it to the entire country. And then you would say, wow, that's a really good plan. That's a lot better than my plan. Or that's a really good grocery card. I only get $50 for a grocery card. That one's $300. Let me call these guys up and see what's going on. And then you call them up and they say, well, do you live in this particular zip code? No, I don't live in that zip code. And then they got you. They got your information. They start doing the hard sell and all the rest of it. So that's kind of a scam. Remember, these Medicare calls that you get coming in, they're not supposed to be doing that. They could lose, whoever calls you could lose their insurance license, could lose their ability to enroll anybody in Medicare. Because if you didn't tell that particular person or that particular person's company to call you, they're not supposed to be calling you. That's it, period. If you go into a supermarket or wherever and there's a table that says, ask me about Medicare, that's why it says ask me about Medicare, because they can't say anything until you actually ask them about Medicare. So the same type of thing on the phone. Unless you tell some, John in Topeka, Kansas, hey, I want to, check out Medicare supplements or Medicare Advantage or whatever the case may be, give me a call. And then John or John's company can give you a call. But what happens is you push a button on Facebook or something and ask about some grocery card, and then they call you up and you say, well, I don't live in that zip code. And they say, well, they try to hard sell. And if they don't sell you on something, then they sell your information to everybody in the country. And that's how you get 20 or 30 calls a day. So be very, very careful. If you need to change your plan, which I think everybody should review their plan coming up starting October 1st, you can change it effective October 15th through December 7th. And if you're going to actually change it, then at that time, the person that is going to help you actually needs your Medicare number, because what happens is if you're actually going to change it, they need to see what you have now. They need to compare apples to apples, and then they need to send that to Medicare. So anytime you make a change, the insurance agent or the company sends that information to Medicare, and Medicare has to have the number. And then they say, oh, okay, you're in this other plan. Medicare automatically contacts that other plan and cancels the other plan effective December 31st. And then they put you on a new one. So if you're with someone that you know and trust, and that's exactly why my son and I picked Chapter, you can reach out to them. You can reach out to them today, tomorrow, this week, and then say, hey, I need to check out my plan starting October 5th, 1st, 15th. Probably give them a little bit of time. They're going to be crazy for the first week or so, but you have until December 7th to get everything switched over. Okay, we've got tons of questions, and if you have any interesting stories yourself about Medicare scams out there, there's plenty of them. Yeah, let us know. Type it in the comments or the live Q&A here. Rebecca, hello. For disabled widows benefits, what does it mean they're conducting a second non-medical review, and how long does that take? Okay, so disabled widow benefits. Number one, awesome that you knew about this. Disabled widows benefits is you're disabled, you recently lost a spouse, and you're between the ages of 50 and 59. So what happens is you file for benefits at your local office, and they do the initial non-medical review. They just make sure you're insured and you're all that kind of stuff. And then they send your case to the DDS, Disability Determination Services. And they're the ones, it's a state agency that makes the medical determination. And once that state agency makes the medical determination, then they send it back to the field office, and the field office just does a double check to make sure everything is still the same. You didn't get remarried, and so that's the non-medical part, that you're still, between the ages of 50 and 59, that you're not insured on your own record for more, that you're still living at the same address, and you still have the direct deposit and stuff like that. So that it under normal circumstances, I've done hundreds of thousands of these myself. It doesn't take that long. But you actually need people in the local office to actually do these. And if hopefully your local office still has staff to do these. So, but it usually takes actually once the case is on your desk and it was an approval or denial, it takes 5 minutes to do. So, but the particular person getting that 5 minutes, they might have 400 other cases before yours. And so that's the issue. So. Focus Lee, hello everyone. I hope everyone's doing okay considering the current situation. Yes, every day above ground is a good day, right? Let's see here. Medicare. Husband just lost Medicaid because he's on SSDI. They say he was accidentally given Medicaid for 4 years, but is over income for non-MAGI Medicaid because he received SSDI. So, okay, so I wonder if he was appealing SSDI, and so he applied for SSDI perhaps like a year or 2 years ago, and then he had to go through all the appeals process, and then they finally approved it, and they backdated it for a year, 2 years, or 3 years, and that kicked him out of Medicaid. That's a usual situation that happens, unfortunately. But accidentally given Medicaid, yeah, that's difficult because what SSDI would do to kick you off Medicaid, if your SSDI is too much, too high, if he's getting too much SSDI in terms of the monthly benefit amount, and that puts him over the allowable income limit for Medicaid, then, okay, I understand that. But most states, they interact with the Social Security Administration's computer system, and they should have known that. That makes sense. That makes no sense that they didn't already know that. And there's some states that they don't care. I've had people in one state, they were receiving SSDI for there's like $2,000 or something, and they were eligible for Medicaid because that particular state didn't count that unearned income from Social Security. But then that person moved to another state, North Carolina, and they were kicked off of Medicaid. Same exact income because that particular state counts that. So I would find out exactly what they're talking about in terms of accidentally. And it's like, hey, you should have known, doesn't your system interact with Social Security? You should have known that he was receiving that benefit. I would definitely fight that one. Ask for an appeal. Any government, anything, Social Security, Medicare, Medicare Advantage, Part D, Medicaid, food stamps, they all have appeal rights. You can appeal anything. So if you disagree with the decision, ask for someone else to take a look at it. That's what you're doing. You're saying, hey, I want to appeal it. I want a completely different person to look at my case again to make sure the first decision was correct. So, hey, Patricia, I retired at 62 and my husband is 54. Is he entitled to anything? If he's disabled, possibly. But in terms of regular retirement benefits, no, because he is just too young, way, way too young. So, best way to protect Social Security is not to vote Dem. Well, Democrats actually started Social Security, and so I'm not sure what that means. I'm afraid to apply for ACA because I know I'm going to get 5 million calls over the next 6 months. No thanks. Yeah, ACA is going through some crazy stuff. I'm trying to work out a system because a lot of people get kicked off of Medicaid, and they're not old enough for Medicare. Then the Affordable Care Act, marketplace insurance is unfortunately the only place they can get health insurance. So we're coming up with, my son and I are working on a plan to find some place for y'all to sign up for that. But not. Yes, possibly. It depends who you call. It really depends who you call. And we're working on that. My son is working on that. We're trying to find a place like Chapter. Chapter does Medicare, Medicare Advantage, Medicare Supplements, Part D. And if you don't call them, they ain't calling you. Like if you say, if Juliana says, sends me an email and says, hey, Ed, tell Chapter to call me. If I sent them an email and they called you, I would be... They wouldn't. I wouldn't be surprised because I know they wouldn't. They can't. I can't tell them to call you or contact you. They would never do that in a million years. If you contacted them directly, and for some reason you called them at 2 o'clock in the morning and said, call me, then you directly said, call me, so they can call you back. But there's a lot of agents out there, companies out there that aren't doing the right thing. It's sad. And then we're getting tons of calls every day. I started taking my Social Security at 62. My husband will be starting his at full retirement age, 67. If he passes before me, when I'm 67, switch over to survivor benefits, will I be getting 100%? Yes, you will be getting 100% of his benefit amount because at that time, you will be your full retirement age. Yep. So if you're your full retirement age at that time, absolutely. So. Bella, we will be ordered to wear government wearables that the government will issue to us, as RFK says. Yes, they're already doing AI, and there's this new medical records that are coming out, and they're going to have all your records, and which I think is good in some respect. I won't wear I wear one myself to track my walking, and I depress myself every day when I don't take my 10,000 steps. But anyway, I promise I'm going to do it tomorrow. I promise I'm going to get 10,000 tomorrow. At my hearing, the ALJ asked me 3 or 4 questions. My attorney asked all the questions. Why is that? That's why I always recommend you know, if you're going to get an attorney to help you with your disability claim, I always recommend a local attorney. You know, there's a bunch of, you know, national attorney, lawyer, disability sweatshops, factories that shall go unnamed because they're very litigious. But I always like local attorneys because the local attorneys know the local judges. So in your particular area, there's probably like maybe 3, 4, 5 different administrative law judges that do disability. And if you have an attorney in your local area, then, you know, they will know the day they find out which judge will be handling your case, they will already have a plan of attack. So this, maybe your attorney is a local attorney and he knows that particular ALJ, that ALJ doesn't ask a whole bunch of questions. You kind of have to feed the questions to him or her. And sometimes it's complete opposite. Oh yeah. Oh my gosh. No, that judge, oh my God, that judge just, it asks questions all day long and he doesn't give you a chance to respond. And so I always recommend a local attorney. So that just might be that particular, you know, the MO. Start to be billed, Medicare comes out of your Social Security from the start. Yes, if you're receiving Social Security benefits. If you're not receiving Social Security benefits when your Medicare starts, then you have to make some type of arrangements to get it paid. Either, you know, you do it like a bill every 3 months, or you go into this, you know, automatic pay type situation. They take it out of your bank account. I am allergic to Wi-Fi. If I hold my phone for a few minutes, my hand fingers start tingling. I can't put the Wi-Fi keyboard in my lap either. My thighs start, oh, wow. They dropped my Medicaid. I'm on disability. This is going to happen a lot, unfortunately. And a lot of people are going to lose Medicaid, even though they're eligible for Medicaid, because the bureaucracy bureaucracy is a necessary evil. You know, it's required. All that paperwork, it's for a purpose, but when you don't have human beings actually doing that paperwork and processing, you're going to have a lot of human errors because there's just not enough staff at those local offices. And just as at the end of the pandemic, where 69% of people who were actually eligible for Medicaid lost it because of bureaucratic snafus. And I think that's going to happen again, unfortunately. So welcome, everyone. Please like and subscribe, share, channel along. Thank you. Yes, please. Please. Oh, yes, I inquired about dark mode for your site. Someone wrote and you read that they would provide me instructions. That never happened. So please pursue on your end. Okay, yeah, someone said, was that you're the same person? You don't look like the same person, but you were in dark mode, I guess, so we showed your video yesterday. Yeah, so the person out there that says they know how to do dark mode from the user standpoint, please let us know. Steve, in the comment section on this video, type it in all caps. Hey, how do I do dark mode? I'll do a little research and maybe pop it in there and give you instructions, or if somebody else knows how to do it, actually has done it before, that'd be awesome. So and then I'm also talking, I talked to my computer guy and he's working on that new program. So, but yeah, we'll get on that. When is full retirement age so I can go back to work full time? It depends on your particular age when you were born, but you can go on to my website, mygovexpert.com, and you can actually on the front page there, let me get it here, overview. So you go on to mygovexpert.com, you click on the retirement thing there, and then you click on the overview tab and you go down right there and you do your full retirement age. Let's say February 6th of 1959. And then you click on that and it tells you exactly what your full retirement age, which there's charts that do that, but then it also goes one step further and tells you exactly when that is. So it's January 2026. So and that calculator is 100% free, as all the calculators are on my website. So let's see what else we got here. Spoke with Jeffrey at Chapter recently and he was awesome. All right, thank you for letting us know. Turns out I had done my research and chose well in my choices. Guess there really is a first time for everything. Yes, I know exactly what you mean. Broken clock and technology and stuff like that. Sometimes I get it right, sometimes, yeah, just by dumb luck. But yeah, you did your research, and Jeffrey, awesome. They do that a lot. They say, okay, here's your plan right now. And based on all the other 20, 30, 40, 50 plans out there and what you need right now, you're in the best plan. But the brand new plans are going to come out October 1st for Medicare Advantage. Part D plans, they'll come out October 1st, and then you will start being able to change those October 15th. And even if you got the best plan, if you have a Medicare Advantage or a Part D plan right now, and it's the best plan for you right now, that's fine, but that plan goes away December 31st at midnight. If you have a Medicare supplement plan, then you're good. But with a Medicare supplement plan, you can change those 365 days of the year and get into another plan, a Medicare supplement plan G. You can go from one G to another G. You can go from G to an N, from an N to a G. But in most states, you'll have to go through health underwriting. It's not as painful as it sounds. You can call a chapter and see if they can save you some more money there. And they are, again, 100% free. Let me look it up. I think I can pick it up at Best Buy store. Okay, someone, is this someone helping someone else? You guys are awesome. I know it doesn't make sense. Are we talking about the government? Should I finish this sentence? We get 2094. Yes, they said over with non-MAGI and can't have my, oh, okay, in Nebraska. Yeah, and with 2094, yeah, usually we're talking $1,400, $1,500, $1,600 a month. Anything over that, yeah, they're probably going to kick you off of Medicaid, depending on your state. My cousin has been kicked off of Medicaid twice. They said it was because he has cancer. What can you do? He keeps filling out forms, get it, then months later he gets kicked off. Help. Okay, so yeah, Medicaid is not necessarily, I mean, there's a disability component of Medicaid, but it's also based on income and resources. So if you have some disabling condition, some condition or whatever the case may be, that's not necessarily the issue. If you just happen to have $1 million in the bank, or you get $1 million a month from income or whatever, then you're going to be kicked off of Medicaid. So possibly that's it. Maybe he gets some type of residuals or something every few months, and anytime that extra money comes in, it kicks him outside of the income limits. Possibly something along those lines. But you just have to keep fighting it, and call them up and say, hey, why do we keep getting kicked off? Oh, it's because of income. What they can do sometimes is rounding. So if you've because some people, for whatever income they have coming in, they don't get it on a monthly basis. They get it like every 3 months or 4 months or something like that. So maybe something along those lines. He's eligible for 2 or 3 months because he's got no income coming in, and then all of a sudden he gets that 3-month income and it kicks him off. Tell them to round and say, hey, this is just the nature of his industry. Round it over the year. So if you take all that income and round it, average it over the 12 months, then he's under for the entire 12 months, and they should be able to do that. So, Ralph, I was rehired by my previous employer, and they are restarting my health benefit. Awesome. Can I cancel my Plan G coverage as well as my Plan B coverage? Yeah, if you cancel your Part B, your Part G will, for all intents and purposes, also be canceled, because you have to have Part B to get a G. So yes, you can cancel those if you now have creditable coverage. And then once you stop receiving that creditable coverage from work, then you have 8 months from that time to sign up and avoid any penalties. And at that time, they should restart because you're starting a new one. I would double check with your, whoever helped you with Medicare, or you can call up chapter and say, hey, to stop it is not an issue. I just want to make sure in your particular case, if a year, 2 years, 3 years down the line, if you want to get back into a Medicare supplement Plan G, that you actually can. So I would triple check on that one. I would call up chapter and ask them about that. You can do a Medicare Advantage with no issues whatsoever. But the Medicare supplement, we want to make sure you don't have to go through health underwriting again. So, Dr. Ed, I am so sick of Medicare Advantage asking me for end-of-life documents. It's so freaking insulting. I want to ask, did you plan yours? Yeah, I told my wife to buy a new refrigerator. They come in really big boxes. So there's my burial insurance now. Yeah, I working at Social Security, and taking hundreds of thousands and helping millions of people out in disability cases and retirement cases and surviving spouse cases and all that, and hearing all the stories, you get kind of, I guess, gun shy about all that stuff, about simple little things in life where that changes everything. So yeah, I would do it. I would just, yeah, I would do it. We're all going to have that. We're all going to eventually shuffle off our mortal coil. So, but we ain't there today. So every day above ground's a good day. So just go ahead and do it. Tell your loved ones where it's at, and go on with your life and live another 100 years. So, Karen, I turned 65 February 2022. I got my first check in May, and they deducted 3 months of Medicare in April. They said I didn't pay that and deducted in the amount. Okay, yeah, so that happens sometimes. First of all, if you turn 65, you get your check the following month, and if you started Medicare before, whatever the case may be, then they deducted 3 months, probably because there was a delay getting your application or something. Okay, so your first check was in May, so you probably applied late, or that local office was underwater and they couldn't adjudicate your claim until May, but you still owed February, March, and April. So yeah, that sounds 100% correct, if just by what information you provided there. Debbie, I retired from the United States Postal Service 1 year ago. I still haven't received my full retirement check. I was CSRS offset. My retirement is based on what I have received at 62. Social Security gave overpayment. Okay, so you were on the old system and you were being offset, and the windfall elimination provision hasn't been applied to you yet. Yeah, Social Security has done 90% of those automatic calculations, so you should have already been unwept. And if you weren't, then yeah, you definitely need to contact Social Security and say, hey, what's going on? Why hasn't my benefit been readjusted based on the Social Security Fairness Act? 90+% of them have already been done. So, Sleepless in Florida. Hi there. I hope you're doing well. Always. I'm currently receiving disability benefits, and I have a question. Where can I go to obtain my disability parking card? Yeah, I think that's a city type thing. So, stop treating older individuals like they are slow and stupid, or deserve less treatment options. Worry about that robo-dialers. Yeah, I agree. Yeah, the robo-dialers, those overseas, and they just look for numbers. So they just call, automatically have some computer that call you up. So Social Security gave OPM the wrong amount, and I am being shorted $1,800. Oh, okay, so that's what's going on. So yeah, you need to reach out to them, and they need to, yeah, get that corrected. So usually, yeah, it's surprising. Social Security gave OPM the wrong amount. It's based on the MBR, the monthly benefit, on the master beneficiary record. That's what interacts. So yeah, that's kind of strange. I would definitely reach out to Social Security, and you got to get that. It's two government agencies trying to talk to each other. I've got some video questions here. Let's see what we have.
Hello, Dr. Weir. This is Deborah from Charleston, South Carolina. I'm trying to help a friend of mine. She doesn't speak very good English. She's Italian. She's already applied Social Security under her ex-husband's benefits, and she received her first check last month, which was June. She also received a letter from for a Medicare card. My question is, she is under workman's comp now for over a year. She hurt her shoulder back in June of last year, and she applied through a Medicare specialist here in the area for a supplement plan, and she was denied. Is there any hope for her to get another quote from another supplement company, or perhaps what should she do? Go for the other plans that are available? Thank you.
Okay, good question. Oh, okay, good question. So yeah, she's after her initial enrollment period. So if she files at 65 when she's first eligible for Medicare, then she's looking for a Medicare supplement plan. Those are the only plans that can deny you after, a certain period. So she was looking for a Medicare supplement plan G or a plan N, and it sounds like she's outside of her original or initial enrollment period, and therefore they can deny her on, for whatever reasons. But sometimes particular Medicare agents aren't licensed or contracted with all of the companies in your particular area. So maybe there's another company, another insurance company, a Medicare Supplement G or N company in your area that just might take her, because they're all a little bit different on what they will accept and what they won't accept. So I would definitely shop around. You can reach out to Chapter, and they're licensed and contracted with pretty much more than anybody else almost, at things nationwide. So definitely I'd reach out to them and see if they can get anything. But if for whatever reason that's it, she just can't get it, and because she's in a particular state that they don't make those insurance companies give it to her, then the next option, yes, would be a Medicare Advantage plan, and they can't deny you on that. So anybody's available to get a Medicare Advantage plan. So, all right, let's see. I think we got a talking
Hello, Dr. Ed. This is Pete from Virginia.
talking deer.
I have a question about SSDI back pay. I was approved back in April, the first part of April of this past year, for my SSDI with 2 years of back pay. Here it is August, and I've still not received that back pay. I re-involved the lawyer because I had to go through the appeals process and had to get a lawyer and all that. They paid the lawyer out of the money, but they never paid me. And she's got this senator involved, and she's mailed them letters, and I have recently got involved with the local office. They've set up a manager to manager, whatever that is, to try to resolve it, and still have not heard anything from that. But 4 months later, I'm still out of the money.
Okay, yeah. As soon as you said manager to manager, I know exactly what he's talking about. So this was a case that was approved by the administrative law judge, the third level of appeals. And then once they approved it, sounds like they did prove it because they paid the lawyer. First thing they do is they pay the lawyer. The lawyer gets 25% of the back pay up to $9,200. And then once they do that, then they do all the other calculations, and then they actually pay you. But that other step doesn't sound like it's happening. And as soon as they said a manager to manager, so that's basically the local manager at your local office contacted the manager at the regional processing center, that particular mod. There's different mods within the region. But anyway, and Elon Musk. Yeah, Elon Musk decided to close down a bunch of those regional offices. So 4 months ago, yep, they probably sent the manager to the manager, and your local district office manager sent a message or priority message to the regional office, that particular mod, said, hey, this guy needs to get paid. You paid the lawyer, pay this money. And then Elon Musk went in there and shut that whole place down. So your case is out in limbo, out in the street somewhere next to the regional office that doesn't have any staff. That's unfortunate. So they are probably trying to find a home for your case in some other part of the country to see if someone can work your case. I would continue to reach out. It sounds like your current politician ain't doing their job, because usually it's a lot more expedited. I would reach out to another politician, your federal senator. Reach out to one of your two senators, or your congressperson, the House of Representative, one of those three people. And then you can go onto their website and click on that little button that says, I need help with a federal agency, or you can give them a call. Yeah, that is completely unsatisfactory. You should have already gotten your money by now. But people actually have to look at it, and there ain't no people there. So, all right, we got one more question. Somebody else shy here.
Hi, Dr. Ed. I just had a question about going to.
Kind of quiet.
Okay, I was trying to make an appointment at a field office.
Okay, it's hard to hear. So already listened to this one, and it's basically she was trying to schedule an appointment at her local field office, and the local field office says, "Well, we're not your office. You have to go to this other office, which is like 70 miles an hour. I think it was like in Ocala, Florida, or something." So tough local office. All district offices, all 1,200 offices throughout the country have certain jurisdictions, certain zip codes that they're responsible for. And if you're in that zip code, that's your local office. But if you don't want to go to that local office, every office, all 1,200 plus offices throughout the country is your office. I always tell them this: call the people up, and if they say, "We're not your office," you say, What's that big sign out in the front of the building say? It says Social Security Administration. Well, then you are my freaking office. Sorry. So all offices in the country, you can go anywhere you want. It doesn't matter. Unless you have like a pending case, SSI, something type of pending, really, really pending right now that someone has a bunch of paperwork and has your files and stuff like that. But normally, no, 99% of the time, no, that's not the case. So you can go to any office you want. And if someone says, "We're not your office," and I say, "Yes, you are. It says Social Security Administration. You are my office. I understand my zip code goes to another office, but I like this office first." And that's why my office was the third busiest in the country, even though there were 2 other offices in our city, because we got the reputation. We won a bunch of awards being efficient and good customer service. And everybody used to come to our office, and we kind of shot ourselves in the foot by being so awesome. And that but we were awesome. Well, it wasn't me, my staff that was awesome. So hey, everybody. All right. Someone mentions the name of a particular company. I always try to avoid the health insurance company names, but I have a Medicare Advantage Essentials. Should I switch to a Medicare supplement? I recommend everybody at least check out a Medicare supplement. If you're able to get a Medicare supplement, because there's no networks, there's no prior authorizations, there's no surprises. Yes, there's a monthly, there is a monthly fee for those Medicare supplement plans, but once you pay your $100, that's pretty much it. With a Medicare Advantage, you're like, oh, it's 0 premium, but then you might have to pay for the, the hospital, pay for the specialist, pay this other thing. So if you can afford it, then check out a Medicare supplement. But unfortunately, a lot of people, it's just not in their budget. So if not in their budget, then hey, it's not in your budget. Dr. Ed, you can get cremated and she only has to buy a new toaster. Oh, I like it. You got the same crazy, yes, gallows humor as I do. Yes, that's. I don't think I'd fit in the toaster. So anyway, handwritten will is accepted in most states. Yeah, and on my website, I don't talk about this very much, but on my website, if you go down there, there is, you can set a last will or a power of attorney for this company my son found, that you can just go in there and do it yourself type thing. You press on the little button there, and it takes you to a website, and they can get it done for you. So if I'm on SSDI, turned 62 in December, outbox is checked. Can I stay on SSDI? Keep Medicare and file for IEDS from X, or stay as I am till 65. Okay, so when you are 62, you're as long as you're disabled, you're going to continue to get SSDI, Social Security Disability Insurance, and yes, you can stay on that and collect other benefits. A lot of people don't understand that. They think, well, I'm 62 and coming up on 62. If I file for surviving spouse or spouse benefits or divorced spouse benefits or independently entitled divorced spouse benefits or whatever I do, that's going to kick me off of off of disability. And because I'm no longer getting disability and I'm under my full retire and I'm under 65, then that's also going to kick me off of Medicare. 100% incorrect. You can continue to get your Social Security disability insurance and get those other benefits if you're eligible for, and your disability will continue. You'll just get extra benefits on top. Not one will offset the other, but you'll get those extra benefits on top. And because you're still getting SSDI, your Medicare will continue. So there's so many people out there that are afraid to get those extra benefits that have, hundreds of dollars extra sitting there waiting for them, but they're too scared because they think they're going to lose their Medicare. So please like, subscribe, share, so we can get this information out there. So Kim, soon to retire, RN getting quarterly bill from Medicare B. This one will turn November. If I end the month, will they take Social Security checks when? Okay, so I would just let the system automatically run its course rather than stopping anything, because if you stop it and they don't pick it up, then you might have an issue with your Medicare. So just go ahead and file for your retirement benefits, start your benefits, and then they will take the money out of the check. Once you start getting Social Security benefits, they'll take Medicare out of the check. If the computer system doesn't recognize you already pay for that month, which unfortunately often happens, they'll give you a credit. So as soon as they realize, oh, Kim already paid for this month and we just took it out again, so there's a double there, they'll give you a credit. So that's usually, it doesn't take that long to get all that fixed out. So I would definitely just kind of I would just file and then let it work itself out. Because if you tried to time it somehow, it says, well, okay, I'll stop paying this month and that'll be the 3 months and then Social Security will pick up. If you get it perfect, then you're good. But if not, then hey. Let's see here. If you're on Social Security's widows, can you change over to SSD and get more money? I'm 77, but can't work. I'm on oxygen. You're 77, so there is no such thing as Social Security disability anymore. Nobody in the country is receiving disability from Social Security after their full retirement age. 65, 66, 67, whatever your full retirement age. Everybody is switched to regular retirement benefits after their full retirement age. So your disability essentially stops. So unfortunately, no. But if you're receiving widow's benefits, hopefully, if, SSDI, okay, wait a second here. If you want to switch over to SSDI on your own record because there's more money there, then there's more money there. You should just switch to regular retirement benefits. If there's more money on your own record than on surviving spouse widow's benefits, then you should have switched over to your own record at 70 years old. So if that's the case, if there's more money there, then reach out to Social Security and say, hey, or if you don't know, reach out to Social Security and say, hey, I'm on widow's benefits and I forgot to check to see if the benefits on my own record is more. Is it? And at the very, very least, they can give you 6 months of retroactive pay and give you that 6 months back. So I can't get through to Social Security for my son who has autism. Can I just go to the office? Yes. And they better let you in and tell them it's emergency if you've got a disabled son and you just can't get out of the house all the time. And so, yeah. And when you go in there and if the local office has an issue letting you in, it's usually the guard. And the guards are not Social Security employees. They're contracted guards through Federal Protective Services, and they're just told, by the local office or that district manager, that office, whatever. We never told our guards to not let people in, except for after 4 o'clock. But anyway, if they don't let you in, just say, hey, this is an emergency thing. This is a public relations thing. I've already contacted my congressperson, and those kind of keywords, the guard their ears will prick up and they'll say, oh, okay. All right, let's go ahead and let you in. So, and then you can get things taken care of. I am receiving widow's benefits. I plan on working till 67. Do I have to take Medicare A at 65? Not if you have creditable coverage. If you have health insurance from work, current work, yours or your spouse's, and your employer has 20 or more employers, then you don't have to sign up. You're gonna get signed up automatically because you're already receiving benefits, widow's benefits. So when you hit 65, they will send you your Medicare card in the mail, the Part A and Part B. You'll keep your Part A because that's zero premium anyway. So the Part A you'll keep. The Part B, if you have creditable coverage at work and you're happy with it and you're 20 more employees and all that good stuff, then you can just deny Part B. But I would definitely check it out because even though you don't have to sign up for, Part B, maybe having A and B in a supplement or a Medicare Advantage or whatever the case may be might be better than your cheaper, more coverage than your health insurance from work. So I would just definitely, just check it out. So. Dr. Ed, we hope you and your family are going on an awesome vacation soon. I actually going to take a few days off here in about a week or so. Yes. So not really a vacation, but I will be gone for a few days. Yeah. I'm glad some of you in chat appreciate my sense of humor. Oh, did I miss somebody's? Hopefully it was a dry sense of humor. Those are the only type of sense of humor yeah, but it's unnecessary diversion to the person. Okay, they're having side conversations here, which is awesome. Thank you to the community. People are good at heart. Thanks again, Dr. Ed, for hosting all of us. Yes, we've got some awesome people here. And once our new project starts here and probably next month, hopefully early next month, you're going to see how awesome this community is. Yeah, you ain't seen nothing yet. You ain't seen nothing yet. All right, let's see what else we got here. Let's see. So someone hit the like button. Since we elected Elon Musk, then he has the right to shut down the offices. Oh, wait, we didn't elect him. Yes, that is a fact. Okay, that's the sense of humor that we're talking about. Yes, exactly. Yeah, whatever happened to that guy? I got an award letter. Says my Social Security starts September. Today, I get a letter saying benefits are to be withheld for Medicare insurance premiums due, but I have paid $185 on my own. They mail a monthly bill and I pay it. Yeah, so it's the same as I told the previous person. They will start taking the Medicare out automatically, and then if there's an overlapping month, just let it ride. Once the Social Security computer system and the Medicare computer system talk to each other, then they will say, oh, we've got Deb's money twice for 1 month. Let's go ahead and credit that back to her. So it always works out. So just let it run its course there. Let's see here. I'm trying to get a copy of my medical from SSDI at appeals level. I thought there was a link given info on Dr. Ed's site. Can't find anyone have a link. Not to get your medical records. Yeah, you actually have to request your medical records from Social Security. And what they often do is they'll burn a disk with all of your records from eView, it's called, EDCS eView. And they'll burn a disk from that, all your medical records. But sometimes it takes a while, number one. And sometimes for Social Security employees are hesitant to give out if you've got, if it's a mental type disability, then sometimes psychiatrists and stuff write in there that, hey, I'm providing you Social Security with all this person's, medical records and valuations and stuff like that, but this is private internal stuff, and I don't want you to provide this to the patient because of, the sensitivity of everything. So, yeah, so Social Security employees are very, very cognizant of that. And if it's a physical thing, then yeah, they'll burn a disk, no problem whatsoever. But anytime there's some type of mental issue, they want to double check. And they better. Social Security employees better check on that. If the psychiatrist doesn't want that information released to that particular person, then you be very careful about releasing it. So I have a medical, sometimes if a person goes to a court and stuff like that and they say, hey, I demand it, then Social Security does it. But they're cautious. I have a medical medication called Eliquis. It costs about $600 a month. And I'm trying to figure out, would it benefit me to get Medicare Part D? I'm not sure how all that works. Yeah, I think Eliquis was one of the ones that the previous president was going to negotiate the prices on that. I think that was one of the ones, the first 10. Yeah, pharmaceutical companies don't want to negotiate anything, so they're fighting that, or I don't know if they won yet on that one. But anyway, whether you should get Part D, if you're eligible for Part D and you didn't get it when you were first eligible, you're being penalized. 1% for every month you did not get it when you were supposed to do it. So if you waited 12 months, you're going to have 12%. 12% of what? 12% of the national average, which is for a Part D plan, which is what, about 30, $35 this year or something. And you'll pay that forever, unfortunately. So, and then if you're having issues, there's also, Social Security has the extra help for your prescription drugs, Medicare prescription drug plan that you can apply for and help out there. So no one's losing Medicaid or Medicare unless you're scamming. No, well, we had someone yesterday that was in Tennessee. They're kicking that person out of the nursing home, and 69% of the people that lost Medicaid during the last unwinding were eligible for those benefits because of bureaucratic. So Rabbit Skills, you have 100% faith in the government that they will process those millions of redeterminations, recertifications for Medicaid perfectly. So you have a lot more faith in government understaffed, overworked government offices than we do. So congratulations to you. Ed, thank you for all you do. You're welcome. My question is, if MD is Medicare AA terminates my plan again for 2026, is that enough to to change back to Medicare plus Medicaid? Yes, yes. I just did a video on this a few days ago about a major company. It sounds like the was it the Christmas Story with the guy with the BB gun? A major award. You might just get a major award, and this major award is your Medicare Advantage plan is terminating your plan. And if you get that, then you'll get the letter that this major company is terminating 600,000 plans, PPO plans predominantly. So other companies are going to follow suit, I'm sure. And if you're terminated, if your case is terminated, your plan is terminated starting January 1st, then you'll get a letter. And it said, sorry, we don't like you anymore, whatever the case may be. And then on the bottom of that letter, it will give you a special enrollment period, guaranteed issue special enrollment. Because your plan has been terminated, you're eligible to get a Medicare Plan F if you were eligible for 2020, or Plan G, not an N. That's not a guaranteed issue, but you'll be able to get a Plan G without going through any health underwriting whatsoever. So there is a lot of people out there that are hoping they get terminated. So. Dr. Ed, where's your Amazon link? Couldn't find it. Yes, thank you. Thank you. I appreciate it. Yeah, to fund all of this new platform and the website and all that kind of stuff, if you go into the YouTube description and then go down probably about halfway, I know there's a lot of junk there, but anyway, you go down about halfway and it'll say the Amazon link there, and you click on it. And if you're going to buy something on Amazon anyway, just click on that and they throw a couple of pennies our way. And every little bit helps, and we appreciate it. My son and I really, really appreciate it. So, and it doesn't cost you anything. Zero. If you're buying a Coleman water cooler, someone bought a Coleman water cooler for $59.95, and it was still $59.95 after they used the link. So it doesn't cost you anything, and it throws a couple of pennies our way. So we appreciate it. Not the old Real ID with the gold star, the planter Real ID from the new plan when we go to digital currency with under the skin patch. Yeah, hopefully I'm not getting under the skin patch on anything on that unless it grows hair back. Then I'm first one in line. When you receive Medicare, how do you know what is the best route to go as far as A, B, C, D, whatever? Yeah, exactly. So yeah, it's Medicare Part A is the hospitalization. Part B covers the doctor outpatient type stuff. Part C, I hate calling it Part C, the Medicare Advantage. Those, the ones with zero premium, most of them. And then you got Part D, the prescription drug plans. And then you have Medicare supplement plans, and those are 10 letters, G and N and F and all that stuff. What you do is when you're new to Medicare, You reach out to someone you know, trust, you reach out to Chapter, they can help you out, and they will go through everything and explain what Medicare, give you more details. And then they will ask you, hey, you know, what do you need? Your prescriptions, your providers, price, and they'll say, you know, they'll talk about Medicare supplement plans, the difference between a G and an N, and then they'll talk about Medicare Advantage plans, the difference between HMO and a PPO, and they'll talk about a prescription drug plan, and they'll go through the whole thing, and they're super, super patient, and they'll go through the entire thing and explain it all, and then get you all enrolled, and that is 100% free. So that's always a beautiful thing. It's free. You already paid for it. All those decades you paid into Medicare and your taxes and stuff like that. When you sign up for a plan, you know, you pay the Medicare plan or you pay the Medicare Advantage, then it's all just like life insurance and everything. You know, they pay a commission and stuff like that. So, but it's already you already prepaid for it. So you might as well get the help is basically how it works out. I started to apply for Social Security at the age of 62, and a week later I called back and told him I didn't want to collect yet. I called and canceled so I could wait till 64. Dollar amount, 62 or 64? Yeah, yep. You have 1 year to do that, withdraw a claim. So it sounds like possibly since you did it a week later, then they were able to stop it, and you didn't get a payment and everything was good. So, yep, so pretty easy. Happens. But that happens quite often, and it's not a big deal if you change your mind. It's the people that call 3 times after that and then change their mind again and change their mind again. I've had that happen. Yeah. Yes. You have any pets? Yes. A cat that we're trying to train. Yeah. But I don't know. Or the cat is trying to train me. I've never had cats. I've always been a dog person, but the wife is a cat person. So I guess I'm a cat person. I think that's how it works out. I'm an estate planning attorney and I want to learn. I can volunteer with a local office. Oh, perfect. If you're a estate planning attorney, I don't do anything at a local office or anything. This is me, YouTube, and the website and everything and all the stuff. So when the new website comes out, we're going to need your help. We're going to need your help. So if you want to appear and you want to talk about what people need to watch out for and stuff like that, reach out to me. Yeah, we want to get as much educational content out there so people are well informed and do the right thing. So my husband is 93 years old and not in good health. Is there something I need to do right away if he passes? Yeah, just make sure everything is locked on. I've told this story before, but I've taken, again, hundreds of thousands of surviving spouse claims, and it's, you know, even if the person is 112 years old, it's always, you know, it's unexpected and it's terrible. And you just have to be prepared, and no matter how old you are, because you never know what's going to happen. So I had this one lady that came in and she had a big book and it had everything in it. So you go down to the, you know, office wherever and get yourself one of those binders and put everything in it. You know, last will and testament, birth certificate, DD 214, all of that stuff. And she had that, and she called it her book of love, her last book of love from her sweet, sweet husband. And he always took care of her and did everything for her, including doing stuff for her when he was no longer there. And she came in, and most people were all freaked out. And, oh, do I have this paperwork? And do I have that? Oh my gosh, where's that? Everything was laid out perfectly. It was all right there. She just turned the page and say, here you go. Turn the page, here you go. And then he had put all kinds of little love notes in there too, in between the documents. And she pulled out. Yeah, so I'm going to stop there. So, so do something like that. Just get everything prepared. And so when something happens in 20 years, you'll be prepared. So what if I don't have enough work credits? My strange spouse, does he already retired? How much? Okay, so yeah, it doesn't matter. If you didn't pay into Social Security, if you're eligible for benefits from someone that did, then you're eligible for benefits from someone did. You had to be married to the person for at least 10 years if that person is still out there. At least 9 months if you were married to them when they passed away. So you have to be at least 62, and it looks like your ex-spouse, estranged spouse, Oh, it's an estranged spouse. So technically you're still married. So if you're technically still married, you never got an official divorce, then yes, he or she, okay. So he already retired. Okay, so that's good. So if he already started receiving Social Security benefits, then you go ahead and file for benefits on your record, and then you file for benefits as a spouse on his record. And if his benefit amount is twice yours, then you'll get some extra money. So I would definitely call up and start that process as soon as possible if you're at least 62 years old. All right, I got tons of questions, and unfortunately didn't get to them all, but I will be back again tomorrow. I'll come up with another topic of the day, and we'll answer a whole bunch more questions. Y'all have a great night, and please